Hello and welcome to today's webinar organised by Thermo Fisher Scientific and focusing on how to increase efficiency in routine oncology NGS workflows. I'm Helen Bristow, editor of The Pathologist, and I'm pleased to be moderating today's webinar, including a live Q&A session after the presentation. But first, please allow me to introduce today's expert speaker, Stephen Stone, Managing Director at Argent Global Services. Steve has over 25 years experience working in healthcare and diagnostic environments with emphasis on measuring and improving patient care pathways. In his 28 years with Argent, he has used his strong leadership and problem-solving skills to provide clients with realistic solutions that have reduced costs and improved operations. Steve has been instrumental in developing many of Argent's engineering and continuous improvement services for the healthcare industry and has managed numerous projects in the manufacturing and supply chain sectors, providing world-class processes to his customers' operations. Steve will be on hand to answer any questions that you may have at the end of the presentation. And please feel free to submit questions at any time throughout the webinar. Just use the chat facility on your dashboard. So without further ado, let's get on with today's webinar. And Steve, over to you.
Okay, thank you for the introduction. And it's a pleasure to be here. And thank you everyone for joining us today. Here are the disclaimers I'd like to share with you before we start. And then just wanted to kind of reiterate the title today. This is how to increase efficiency in routine oncology and NGS workflows. And so I wanted to share a little bit about who Argent Global Services is, because I think it'll help you understand better the methodology and how we approach this type of work and the type of studies that I'm going to be presenting to you today. And so Argent is an industrial engineering consulting firm with over 30 years experience working in healthcare environments with an emphasis on measuring and improving patient care pathways. And really, we pioneered industrial engineering services within the diagnostic industry and have established ourselves as laboratory workflow experts. But why would we use industrial engineers within healthcare? And so it's really kind of an interesting thought. And you look at the discipline of industrial engineering, it's really about the study of people and how they operate within their systems. Industrial engineers really like to focus on designing and optimizing complex processes and systems that improve efficiency, productivity, and quality. And really, to accomplish these things, the goal is to make work easier for people. So just to get back to today's topic, let's talk a little bit about next generation sequencing. And so NGS is a technology used to study genetic variation associated with diseases. And the speed, throughput, and accuracy of NGS has revolutionized genetic analysis and enabled new applications in genomic and clinical research and precision medicine. And so let's look at precision oncology and then those potential benefits. And so next generation sequencing is the primary method of testing used for precision oncology. And precision oncology can improve treatment effectiveness by targeting treatments to patients who are most likely to benefit. Precision oncology enables individualized care. But there are demands with this, and as oncology testing demands grow, labs are under pressure to deliver accurate results faster with fewer hands and tighter budgets. And with these demands for NGS testing, laboratories face operational challenges, including things like complex workflows, skilled labor requirements, and resource constraints that can limit both efficiency and the scalability of testing. So let's take a closer look at some of the questions that this session will be talking about today. And so hands-on time versus turnaround time. What will actually change when workflows are redesigned? We'll be looking at how automation supports efficiency in precision oncology testing and where labs can cut bottlenecks without compromising their quality. And also, what are the ways we can optimize resources as testing volumes grow? So we've talked about efficiency a few times, but what does it really mean to be efficient? So just breaking it down into its basic definition, efficiency is about performing a task or function in the best possible manner with the least amount of wasted time, effort, or resources. It's really about getting the expected outputs with the fewer or the fewest possible inputs. And so what kinds of things could be impacting efficiency with next generation sequencing? And so numerous manual activities, separate steps, as well as a lack of integration across those tasks. We see excessive wait times. We also see idle times in typical NGS workflows. And then also there's that need for skilled labor. And so these are all things that can definitely affect efficiency within NGS testing. So to look at these questions, Argent conducted a comparative assessment of 2 NGS workflows for genomic biomarker profiling to assess efficiencies and enable labs to better understand challenges. This study was actually published as an abstract and poster presentation at the AMP conference this year in 2025. And so now I'd like to share those results with you as part of this session today. And so first I want to introduce who our study partner was. And so we conducted this study with the University of Pesch in Hungary. And the university hospital serves southern Hungary with approximately 500,000 patients within their area. They have different clinics and hospitals around that area, but specifically we were working in Pesch, where they have a large kind of typical academic hospital of 400 plus beds. They offer the typical laboratory services as well as pathology and molecular genomics. And then their main laboratory services are conducting around 2.5 million tests per year. Looking at the objective and the overview of the study, and so the goal was to quantify workflow demands and assess the impact on efficiency and labor requirements in a real-world laboratory setting between 2 NGS systems. And so the 2 different workflows that we observed as part of the study was one, an amplicon-based NGS workflow, which was the Oncomine Dx Express Test. And then we also observed a hybrid capture workflow. And so the methods of the study is that this was a side-by-side comparison of both workflows. And so we actually conducted testing in the lab for both workflows during a week and a half in the laboratory. We observed routine laboratory work that was conducted by the actual laboratory staff, and they were following their SOPs for both workflows. And so we were doing real-world testing in their lab with their people within their own benches and environment with really no influence on how the work was conducted. Now, the study was conducted very specifically by Argent Global Services engineers, and this study was done through direct observations and time and motion study. And if you haven't been involved in a time and motion study before, it's really about shadowing the different technologists and personnel in the lab that you're studying and documenting every step that they conduct very carefully, documenting the resources that they utilize, and then putting the time studies into very fine elements. And then we can summarize and use that time study data to understand the real requirements for each step. Another method that we followed with the study is that we conducted testing on the same 6 formalin-fixed, paraffin-embedded patient samples plus 1 control. And so we had a very much a side-by-side fair comparison between the 2 workflows. Let's look at the 2 workflows that were included in the study. So on the top, we have the Oncomine Dx Express Test. And the first step that we observed was the nucleic acid purification and quantification. Now, this is a blue box. There's a key at the bottom there that indicates that this was an automated step. And once that purification and quantification was done, we then observed library preparation and sequencing. This is also done on an automated platform, actually the Genexus DX Express system. And then in addition to sequencing, the analysis is done on the platform. And then the gray box is reporting, and that shows that that's done by the bioinformatics team. And so after the analysis is done, the results are handed off to bioinformatics for them to review. Now, the second workflow we observed is the hybrid capture workflow. And The first step we observed there was that nucleic acid purification. It was done on the exact same platform as the Oncomine, so they were both done on that extraction and purification platform that includes quantification. Now, per the SOP for the laboratory, they also did a manual quantification step after that. And so the manual steps I show here in a light red. And so this was a manual step done in the laboratory. And then we observed library preparation for that hybrid capture workflow. It was also manual. Once the library preparation is complete, it was then loaded onto an automated sequencing platform. Those results, though, were handed off to the bioinformatics team for analysis and for them to process those results. Okay, so let's look at the results of the study. And so I'm going to share with you some key metrics related to productivity and efficiency. And so the first result we'll look at is total turnaround time. And so this is the total time in hours to get to analytical results. And this is for the 6 samples that were observed on both workflows. And so we've also stacked our data here. If you look at the bar chart on the right-hand side of the slide, we have the dark blue is the total labor time. The orange section in the middle of the stack is the actual walk-away time. So that's still labor, but it's they're able to walk away from the process and do other things. And then the pink is an overnight or an idle time that was required for the hybrid capture workflow. And so the hybrid capture came in at 88.9 hours, so roughly 89 hours to get to an analytical result for the 6 samples. And then the ODX ET actually took only 26.8 hours to receive results for the same 6 samples. And so the turnaround time was actually reduced by 62 hours with the ODX ET. Okay, I think more importantly, though, let's look at the timeline that's associated with those turnaround times. And so we developed these timelines here that help you understand the timing and when the testing activities took place. And so this is a 24-hour timeline that goes from 8 o'clock in the morning until 8 o'clock in the morning. And this is the workflow for the 6 samples. The top part is the ODX ET. And so we show on day 1, there was extraction and purification, and then loading a system for sequencing. And so the labor steps are the colors such as the orange, the blue, and the purple. And then the green time is the actual walkaway time. And so we see that on day 1 of the workflow for the ODX ET, the automated sequencing system can be loaded roughly around 1700, so about 5 o'clock in the evening. And then when the technologists can go home for the day, and the ODX ET, that platform would run overnight. In the morning, around 10 o'clock in the morning, the results will become available, and then the bioinformatics team can handle those results. And so this result really is about a slightly over 24-hour turnaround time and about a 2-day process to get to results. Now, if we look at the hybrid capture workflow, day 1 starts out the exact same process. I discussed that earlier, that they're using the same platform for the extraction and purification. That actually ends at around 1500, about 3 o'clock in the afternoon. And so there's really not enough time to go into the manual quantification step for that workflow. And so we actually transition into the yellow bar, which is what we call idle time or waiting time. And so there's really no testing activities or anything productive happening. And so we're just in a waiting status. So first thing in the morning on day 2, they're able to start that manual quantification that was required for the hybrid capture workflow. And then once that was complete, they transition into the manual library prep. And then they're on day 2, that long green part, that's actually the hybridization step. That's all walkaway time. The technologist can go do other things. But because the hybridization goes up to about 11 o'clock at night and then ends, there's nobody in the lab that late in the evening. So we transition to another yellow period, which is an idle or wait time, and takes us into day 3. So the morning of day 3, the technologist can begin kind of that second part of the library preparation. They can finalize that, and then they move into the preparation for the sequencing. And then they can load the automated platform for sequencing. And then the turnaround time on that, it would run overnight and then run throughout the next day. And then those results were available on day 4, but only until about 11 o'clock at night. And so they had results at the end of day 4, but 11 o'clock at night, there's no technologists or informatics available. And so first thing in the morning on day 5, then they can process and handle those results. And so that really, it's a little over 4 days to get the work done, but then it's really day 5 before any resulting can take place. Okay, let's also look at hands-on time. And so hands-on time is defined as the active manual steps directly required for each of the NGS workflows. So the hybrid capture required 451 minutes of hands-on time, whereas the ODX only required 41 minutes. And so that's that is a 91% reduction with the ODX workflow. And then I think more importantly, let's look at attentive labor. So this really is a better picture for all labor. And so attentive labor is defined as all labor or waiting time for the tech without the ability to walk away. And so we have our stacked bar charts here again. So we're looking at sample preprocessing, the purification and quantification steps, the manual quantification, prep, sequencing, and then results transfer. Okay. And so for the hybrid capture, the total attentive time was at 661 minutes. And for the ODX-CT, it actually took 260 minutes. So it is a reduction. Now, one thing we're showing on this bar chart is that the first 3 steps of the process were really the same for both workflows. And so even though the quantification was done on that purification platform, like I had shared with you earlier, the manual quantification was done, and so we wanted to include that into the workflow for the ODX-CT because that's how the lab chose to proceed with that workflow. And so it just makes it more of a fair comparison. But even with that 63 minutes of labor time as part of quantification there, we're still seeing a 61% reduction in time for the ODX-CT in the total attentive labor time. Now, if you look at the key steps of library preparation and sequencing, we actually see a 77% reduction in labor time for the ODX-CT. Okay, now another result is manual pipetting. And so looking again at those key steps of library preparation and sequencing, we actually looked at manual pipetting events. And so the way that we're defining a pipetting event is any kind of manual motion of pipetting from a reagent back to a tube or some kind of a testing cup. And so it doesn't matter if it was a single channel pipette or a multi-channel pipette. We're not counting the actual pipette tips here, which would be a much higher count. We're very specifically talking about the actual manual motion. And so with the hybrid capture workflow, just for the library preparation and sequencing, it required 537 manual pipetting events, whereas the ODX-CT only required 57 for the same 2 steps in the process. Now, we also have some observations to discuss and share. And so let's talk about setting up a bench or resetting a bench between steps. And so these typically happen at the start of each day or in between key steps when a tech may have to reset or even move benches. And so the types of things that we're looking at here when you set up a bench is that you have to have the right SOP. You have to have your samples collected. You need to retrieve any kits, reagents, controls, make sure you have consumables and supplies available at the bench. Make sure you have the proper pipettes and the right equipment at the bench as well, especially in a lab where those things might be shared. And so all these are things that could take some time or could be an opportunity for a delay or bottleneck. And so if you look at how many times we observed a bench reset or a bench change, it was 3 times for the ODX-CT Express test, and then only 7 times for the hybrid capture workflow. And so there was a little bit of a difference there. And then kind of on a similar note, we looked at times to retrieve or maybe return and set up reagents. And so this was any time that a tech would leave the bench and go to a cold unit to retrieve an assay kit, reagents, controls. This wasn't your basic supplies and stuff. These are the very specific items needed per the SOP for each step of the process. And so with the ODX-CT, there was actually only 3 times that they would go retrieve and return reagents. And then on the hybrid capture workflow, we actually observed approximately 29 times that they were retrieving and returning reagents. And we rounded that down to 29 because there were a few times where human nature, they may have taken a second trip or forgotten something. And so just per how the SOP would be written, we just consolidated a few of the steps and called it 29. But that's 29 times that the tech would be required to either leave the bench during a process or maybe at the beginning of setup to go to a cold unit to get the kits that they would need for that step in the process. And then another observation we made is really around lab design. And so if you look at traditional lab design, it can definitely contribute to inefficiencies. And so I have an example here on my slide to the right. And this is a very similar layout to what the University of Pesch's laboratory had. And so what you see is with compartmentalized rooms and benches, they create different types of barriers, congestion, and extra travel. There's also a requirement to have pre and post PCR separation with the manual library preparation steps. We see things around supply and specimen storage locations that can lead to efficiencies or inefficiencies as well. And then it's not uncommon to have specimen processing in a different location, as we observed with our study as well. It's not saying that these are a bad thing, but when you have to have these types of layouts to support manual processes. And what we typically see, and what this study showed us as well, is that manual workflows with multiple steps and different bench changes are really most impacted by design. And so that's when you really see the issues coming up the most. Okay, and so part of the result is that we wanted to create some different models as well, to just take the results of our study a step further and share some more information with you. And so the way we approach these models, I have a few notes here to explain how we created them. And so the time study data that we collected during our observations was actually calculated in both fixed and variable time. And I'll give you some examples of what that means. So fixed time is really based on like a batch or a run. And so the time to set up a batch process has fixed time, regardless of how many samples are in that batch. For example, going to a refrigerator to get a reagent kit and setting up that reagent kit. You're going to do that one time regardless of how many samples there are. And then variable time is the time needed for each sample. And so you have fixed time to get that reagent kit. Now the time it takes to pipette for each sample, that's variable by the number of samples. So whether you have 1 to 6, we understand what's variable and we understand what's fixed when we look at our time studies. And then with that, it's a fair way to model different batch sizes. We studied 6 samples, but we're able to model different batch sizes as long as those numbers are aligned with the protocols and the SOPs for the 2 different workflows. Okay, so the first thing we'll look at as our modeling is attentive labor. And so what we wanted to do was focus on the manufacturer's required steps. So this is the same graph I showed you previously, but we did 2 things here. Following the manufacturer's required steps, we removed the manual the manual quantification from the ODXET. We also wanted to just look at the medical technologist's time in the lab. And so we also removed the bioinformatics time. And so we still have the same 4 steps we looked at previously. But looking at just the required workflows from the manufacturer, we have 615 minutes of attentive labor time versus 184 for the ODXET. And so that's actually a 431-minute reduction for the ODXET. And so we want to use this labor to model some costs. So you can maybe reference this more to your environment. And so if we look at labor cost, so we're looking at just the laboratory technologists, and we wanted to understand for that. So we're modeling this off that run of 6 samples, just like we showed on that previous slide. And we took an average U.S. wage, and so that was $28, plus we added a 35% burden. And so if we take the minutes from the previous graph and multiply those out, the hybrid capture workflow for 6 samples, 1 run, would cost you $387.01 in attentive time for your medical technologist. And then the ODXET would be a little over $115. And so really the hybrid capture system required more than 3 times the labor cost. And so this is just for the specific attentive time. And then the actual cost could be higher due to unproductive time between activities. And then, of course, what we've seen on previous slides is that with the hybrid capture system, there are more activities and more manual steps. And so there's really more opportunities to have that unproductive time as well. And so this is really a very much a direct cost to your attentive time only, though the cost itself could be higher. Okay, so this is the cost for one run, but let's model that out and look at some annual volumes. And so we selected some volumes that match up well with the kind of the batch sizes that we would expect to run on these two systems. And so we have a low annual volume of 208 samples per year, and we model this all the way up to 816 samples per year at our highest. And so the graph here on the right shows you that, where it says specimens or samples per year. At the top is 208, and then 312, and then 416 samples per year, et cetera, all the way down to 816 per year. And then we took that fixed and variable time, as well as we really wanted to optimize the weekly workload and runs for both systems. So we selected the runs that make the most sense for exactly how the lab would do it. That way there weren't any like partial inefficient runs unless they were absolutely necessary. And that allowed us to calculate out how much labor time would be required for each one of those. And so let me give you an example. We'll just look at the 416 samples per year. And so at 416 samples per year, modeling this off our time and motion studies, the ODXET required 221 labor hours for the whole year. And the hybrid capture needed 526 hours labor to get the same amount of testing done, to get the same 416 samples done. And so that's the comparison chart on the right. At 208, it was 155 hours of labor for the ODXET and then 263 for the hybrid capture. And then the bottom one, it's only 251 hours of labor needed for 816 samples, but it's all the way up to 725 hours of labor needed for the hybrid capture workflow. Okay, so that's just looking at hours for that attentive time. But let's talk about how we can maybe put that into an annual labor cost and then also resource planning, which will probably make a little bit more sense. And so I took the exact same data from the previous slide, and I applied that $28 per hour plus the burden. And so the table here on the left-hand slide gives you the specific annual costs. And these numbers mirror the number of hours that you saw on that previous slide. We also wanted to look at full-time equivalents. And so an FTE is a full-time equivalent. And what that says is based on 2,080 hours per year, which would be a typical salary for an annual salary for an associate. That's 52 weeks at 40 hours a week. And what is the equivalency related to that full-time year? And so we have those figures here on the right-hand side. Now, so just as an example, if you look at the volumes between 600 and 800 per year, the hybrid capture would need around 1/3 of a full-time person. So you see there at 624 samples per year is 0.3 of an FTE. So it's really roughly 1/3 of a full-time person. For the same exact volume range of 600 to 800, the ODXET would need around 10%. It averages between 9 to 12%. Okay, and then the comparable dollars are off to the left. All right, so what did we learn from the study? Okay, so the results of the study showed us that the ODXET required significantly less labor and overall cycle time to prepare and sequence patient samples, but also providing a much faster overall analytical turnaround time and then also greatly increasing efficiency. We saw that there are fewer manual pipetting events with the ODXET, and then we would expect from our observations with fewer pipetting events, then there's fewer opportunities for things like errors, delays, and waste. And then the automation reduced steps and greatly simplified the workflow. Okay, and let's look at how automation can impact efficiency. So with automation, we see that we can greatly reduce the manual activities. And when this happens, we're also reducing both waiting and idle time. And then when we integrate the functions, we do see a lot of we see reduction on hands-on time, and we also see faster turnaround times. There's also reducing opportunities for delays and bottlenecks. With the automation, we're also reducing the requirements for skilled labor, and we're reducing the impact of lab design and the other barriers that we've discussed in today's presentation. Now, I want to bring it home and just share with you a little bit about some of the inefficiencies and bottlenecks that we were observing during our study. And so I want to share with you again the timeline from previous in the session. And so if we start out and look at day one of the hybrid capture workflow, so I described that we finish up with the purification step. And because there's not enough time in the day to start the next manual step, we actually have our first idle point. And so this really becomes kind of a barrier or a bottleneck to getting the testing done because we enter an overnight stretch of unproductive time. We also have these kind of back and forth manual steps where we have some walkaway time, but in general, we don't have a lot of efficiency. In these periods of time, we have a lot of manual pipetting, as well as the bench changes and a lot of reagent collection. And so these steps are resulting in the technicians getting up and down quite a bit, kind of shifting gears and doing different things as they're transitioning through the different steps of the manual library preparation, as well as preparing for the sequencing platform. And then at the end of day two, we have another one of these processes where, because the hybridization finishes so late in the evening, that we enter another idle time where we don't have anything productive happening with the testing. And then a similar situation at the end of day four, where we get our results in 4 days, but because it's so late at night, the laboratory doesn't have the ability to do anything with it. And so then resulting does happen on day 5. So it adds another day to the turnaround time, which means it'll be another day before the provider receives their results. Okay, so let's look at the big picture as well, beyond just the conclusions from our study. And so the efficiency of an automated workflow can also provide faster results that should improve timely treatment decisions, back to the provider getting their results faster. We also would expect that the automated workflow would be able to free up your laboratory staff and your resources for other opportunities. Is there other work that's not being addressed? Is there more research that you can take on? Are there other revenue generating streams that you could take on if you had more time? Also, this type of a workflow should give the commercial labs more flexibility and can help them meet their increased demands. And then another one that I like, and we have this discussion quite a bit with the labs we work with, is that this type of a workflow really gives community-based hospitals an entry into NGS testing. And so it can be very difficult for community-based hospitals to have the skilled labor, the time, and the resources to be able to do a more traditional manual workflow. And so we feel like the automated workflow does give them that entry into this testing arena. Okay, so let's kind of wrap up with some key takeaways from everything we've discussed today. And so effective implementation of genomic profiling is critical for patients to benefit from precision oncology. Complex workflows, skilled labor requirements, and resource constraints limit efficiency and scalability, and they still remain key barriers. But an automated NGS assay can help remove these barriers by reducing labor requirements, simplifying workflow and removing bottlenecks, greatly improving turnaround time for results, and providing scalability with no decrease in quality. All right, and thank you very much